Hello, today I will be discussing the One Big Beautiful Bill and its impact on the recent legislation that marks a major turning point in US healthcare, particularly Medicaid. So, hello, my name is Zadie Sung and I'm from Dallas, Texas, and I'm a senior in high school and I go to Ursuline Academy of Dallas. So here's a little intro of what we'll cover today. So first we'll look at the history of Medicare and Medicaid, which sets the stage for understanding the changes introduced by the One Big Beautiful Bill. Then we'll discuss the bill's reforms, explore who is being affected, discuss the economic and public health consequences, and then we can discuss at the end on what we can do moving forward. So some historical context for Medicare and Medicaid. Medicare and Medicaid were established in 1965 to expand healthcare coverage in the U.S. Medicare covers the elderly and certain disabled Americans, while Medicaid targets low-income individuals and families. Over the decades, these programs have evolved and changed with reforms like the Balanced Budget Act in 1997, which created private plan options, and the Affordable Care Act of 2010, also known as Obamacare, which expanded Medicaid eligibility and preventative care for underserved communities. So, here's an intro for what the One Big Beautiful Bill is. So, the One Big Beautiful Bill represents a major shift in U.S. healthcare policy. It introduces the largest cuts in Medicaid in history, implementing work requirements, more frequent eligibility verification, and higher copayments. Economically, it is controversial because these cuts combined with tax reductions are expected to increase national debt by trillions of dollars, despite their claim of deficit reduction. So the main major Medicaid changes. So these reforms drastically change how recipients can access Medicaid. Able-bodied adults must work, volunteer, or attend school for 80 hours per month to be able to stay eligible. Eligibility verification moves from once a year to every 6 months, creating administrative challenges as well as something called churn in coverage. Additionally, co-payments up to $35 could discourage preventative care, potentially reducing Medicaid enrollment by over 10 million people. So some case examples is the Arkansas Works and Kentucky Health. So past attempts to implement work requirements showed the risks. Arkansas and Kentucky tried these policies under previous administrations, but they both faced court challenges and public backlash due to coverage loss. The One Big Beautiful Bill may replicate these nationwide, threatening millions of Americans access to health care. So, impact on vulnerable populations. The bill cha changes disreport the bill changes disproportionately affect vulnerable populations. Children dependent on Medicaid and CHIP may face gaps in coverage. People with disabilities struggle under strict work rules, and legal immigrants may even lose eligibility. Rural hospitals face massive funding cuts, potentially creating healthcare deserts where residents have limited or no access to care at all. So, budget implication. Supporters claim the bill reduces the federal deficit, but independent analysis suggests otherwise. Despite the 4.5 trillion in tax cuts and 1.2 trillion in spending cuts, the bill may increase the national debt by 3.3 trillion over the next 10 years. States face 340 billion in Medicaid cuts, forcing difficult budget choices that could affect schools and other essential services. Public health effects. Public health is heavily impacted. Millions will lose coverage, disrupting access to primary care, prescriptions, and preventative services. Families may delay care, worsening health outcomes. Hospitals, especially in rural areas, like I said before, will face financial strains, leading to reduced services, overcrowded emergency rooms, and deeper disparities in healthcare access. So, the future. To address these challenges, coordinated action is essential. Individuals must navigate new requirements carefully. Communities can strengthen support networks through outreach and education. Hospital needs need to plan to manage increased uninsured patients. Policymakers should consider reforms that reduce administrative burdens and expand coverage to protect the healthcare safety net. And some key takeaways is, in summary, the One Big Beautiful Bill represents a major shift in Medicaid and U.S. healthcare. Vulnerable populations, rural hospitals, and public health systems will face challenges, while the nation's death is projected to rise. The path forward requires awareness, advocacy, and a coordinated action to preserve essential healthcare protections. Thank you.